Non-alcoholic fatty liver disease. Do you have it? Non-alcoholic fatty liver disease is one of the most common types of liver disease in the United States. Between 30 and 40% of adults have non-alcoholic fatty liver disease, and experts estimate that about 20% of people with this disease have an advanced form of non-alcoholic steatohepatitis. What is non-alcoholic fatty liver disease? Its stages, causes, complications, methods of diagnosis and treatment? In addition to those most susceptible to infection. Everything you need to know about this disease, you will find below. What is non-alcoholic fatty liver disease? Non-alcoholic fatty liver disease, NAFLD, is an umbrella term for a group of liver diseases, in which the storage of a large amount of fat in liver cells is its main feature, and it may affect people who drink alcohol in small amounts and even those who do not drink it at all. Put another way, non-alcoholic fatty liver disease is a condition in which excess fat is stored in a person's liver, but this fat accumulation is not due to excessive alcohol consumption. Symptoms of non-alcoholic fatty liver disease. Patients with non-alcoholic fatty liver usually have no obvious symptoms in its early stages. Some of these people complain of the following mild symptoms. Feeling tired and lethargic. Pain in the upper right abdomen. Possible symptoms of advanced non-alcoholic steatohepatitis may include accumulation of fluid in the abdomen, ascites, enlarged blood vessels under the surface of the skin, splenomegaly, redness in the palm of the hand, yellowing of the skin and eyes, jaundice, swollen arteries in the esophagus, esophageal varices, which can rupture and cause bleeding, confusion, drowsiness and stuttering, caused by hepatic encephalopathy, liver cancer. Diagnostic methods for non-alcoholic fatty liver disease. Since the symptoms of the disease may be mild and similar to the known symptoms of other diseases, doctors resort to several ways to diagnose it. The most prominent of these are 1. Liver function test. The disease is often diagnosed after a blood test called a liver function test. But a blood test does not always reveal the disease. 2. Ultrasound examination. An abdominal ultrasound can be used to diagnose the disease. 3. Taking a biopsy. Some patients need a biopsy to help with the diagnosis. In this method, a small sample of liver tissue is taken using a needle for examination in the laboratory to diagnose non-alcoholic fatty liver disease. 4. Other investigations. If the patient is found to have this disease, further tests may be needed to determine the stage of the disease. These tests could be a specific blood test, or another type of ultrasound. Note: children and teens who are at high risk of developing this disease because of chronic conditions such as type 2 diabetes or metabolic syndrome should have their liver ultrasound done every 3 years. People most at risk of developing non-alcoholic fatty liver disease. Although the disease affects people of all races and ethnicities, it is more common in Hispanics, and less common in African Americans. A study conducted by the National Institute of Diabetes and Digestive and Kidney Diseases also showed that people who underwent cholecystectomy were more likely to develop this disease. Causes of non-alcoholic fatty liver disease. The pathophysiology of the disease is still not fully understood. According to existing theories, the most important causes of the disease are insulin resistance, which can lead to hepatic steatosis and even the resulting hepatitis, in addition to other factors, most notably overweight or obesity, especially central obesity, where the waist circumference is 102 cm in men and 88 cm in women. Insulin resistance. High blood sugar, prediabetes or prediabetes, type 2 diabetes. High levels of fats in the blood, especially triglycerides. Sleep apnea. Hypothyroidism. Hypopituitarism. Polycystic ovary syndrome. Metabolic syndrome, or metabolic syndrome, is a group of features and medical conditions associated with overweight and obesity. Doctors diagnose this syndrome when a person suffers from 3 of the following diseases. Swelling of the upper abdomen. High levels of triglycerides in the blood. Low levels of HDL cholesterol in the blood. Hypertension. The combination of some of these diseases appears to cause the liver to store a lot of fat. This extra fat acts as a toxin that harms liver cells for some people, causing liver inflammation, a buildup of scar tissue and eventually cirrhosis. Genes. Research also shows that certain genes may increase the risk of developing non-alcoholic fatty liver. However, experts are still studying the genes that may play a role in its development. In the case of the disease, people have fat in the liver that is not caused by alcohol consumption. If the person has a history of heavy alcohol consumption, the doctor may diagnose the condition as alcoholic fatty liver rather than non-alcoholic fatty liver disease.